we will go to our last briefing, which is a panel discussion on racism and police violence as a public health crisis. And then we will go to public comment as well. So for the members of the public who've been raising their hands and wanting to make comment, your time will come right after this last panel. So with us today are Edwin Lindo, Dr. Estelle Williams, Dr. Benjamin Danielson, Dr. Analisa Abraham, and Dr. Pamela Collins. Whoever would like to go first, you may please proceed. Thank you so much to all of you for being with us.
Wonderful. Thank you so much. I appreciate you and the entire council for letting us present today. Again, my name is Dr. Estelle Williams. I'm a general surgeon at the University of Washington, assistant professor of surgery. And I will just open this up and then we will go on to some of my colleagues who will be presenting some more of the specifics. But just to set the tone, I penned a letter that was distributed through the University of Washington and the health system. And we are, as physicians, wanting to include our voice and our message from a public health standpoint. This, again, are reflections of our own opinions as public health experts, but want to, as a collective voice, highlight the health implications of police violence and its impact on communities. And I would like to just open by saying that the way in which we view this is the public health crisis at hand is the police violence in and of itself. And until we address the racism and police violence as a public health crisis, we will continue to have marginalized communities and communities of color that are being disproportionately impacted. And so I have included a couple of my colleagues in this conversation, and we'll begin with hearing from Dr. Pamela Collins, who is a professor in the University of Washington in the Department of Psychiatry, followed by Dr. Ben Danielson, medical director at Odessa Brown. This will be followed by Dr. Analisa Abraham, who is medical director at Harborview Pediatrics Clinic, followed by Edwin Lindo, who is a lecturer within the Department of Family Medicine. So Dr. Collins.
Thank you. Thank you very much. And it's a pleasure to be here. And thank you for the opportunity to speak. So I think all of us realize that the social environment in which we live influences our mental health. The effects of our social experiences will, of course, differ according to our personal histories and the context in which we live. And this is important because mental and substance use disorders as a group are the leading causes of disability in our state as well as globally. In Washington state, about 18% of people live with a mental or substance use disorder, and that's nearly 1 in 5 people. And pretty much when you ask a group of people on this call, sitting in a room, everyone knows someone who is affected by a mental or substance use disorder. And these conditions cause suffering and distress for individuals who experience them, and often the people close to them. And I want to set the stage for this because I want to make clear that having a mental health condition like major depression, as well as more severe conditions, is also associated with excess mortality. So when I talk about these conditions, I'm talking about not just disability, but also excess mortality. We usually associate them with deaths by suicide, but about 8 million excess deaths due to cardiovascular disease, due to pulmonary disease, due to other non-communicable diseases, as well as infectious diseases occur among people with a diagnosed mental disorder. So that is the context. So when we talk about the social environment increasing risk, Black Americans, for example, are nearly 3 times more likely than white Americans to be killed by police and 5 times more likely than white Americans to be killed unarmed. And these disparities are rooted in cultural and structural racism. And we know that racism has consequences for mental health outcomes. Racial discrimination is a driver of poor health outcomes, including mental health. A recent review has shown that discrimination is linked to negative emotions, declines in trust, increases in mood and anxiety disorders over a lifetime. And a greater number of these experiences of discrimination is cumulative. The effects are cumulative and is linked to higher levels of depressive symptoms. Ethnic discrimination is associated with emotional distress, decreased well-being, self-esteem, self-efficacy, and experiences of discrimination decrease our psychological well-being and lead to the increased risk of psychiatric disorders. So it turns out that this discrimination that people experience directly is important in health and mental health outcomes, but it also turns out that racism can be experienced vicariously as well. And a recent study in the Lancet Medical Journal found that police killings of unarmed Black Americans also affects the mental health of Black American adults in the general population. So in other words, there's a spillover effect for other Black American adults, usually living in the same state. This means that such killings lead to a greater number of poor mental health days for Black Americans. And at a population level, police killings of unarmed Black Americans could cause up to 55 million excess poor mental health days per year among Black American adults in the United States. So what do we do about this? We first need to ensure that these killings stop. That's the first thing. The second is that we need to increase access to a range of community-based, culturally and structurally competent mental health resources for Black Americans. And I want to make one more comment, and that's about people who are living in communities anywhere who have an identified mental disorder, who have a mental health condition. I think the second action that we need to take is to ensure that when there is a moment of crisis, when people are in crisis, when they need to call, when family members need to call for help because someone is having an emotional crisis of some sort, we need to find alternatives to the penal system for coming to meet their needs. So I'm going to wrap up. My messages are that the violence that Black Americans specifically experience at the hands of police, even observing other unarmed Black Americans experiences violence, is a threat to mental health. And threats to mental health are serious because they have long-term health consequences. And secondly, we need to take care of the mental health of people who are already living with these conditions, ensuring that they don't unnecessarily get involved with police violence, and ensuring that there are humane ways of meeting the needs of individuals in the community who are living with mental health conditions. Thank you.
Dr. Danielson.
Thank you, and thank you to everyone for allowing me to speak for a few moments and continue on this discussion point. I wanted to also say it's nice to see some of my old colleagues on the Board of Health. I miss you all, and it's very nice to be part of this group of people that are here. I respect everybody on this call today. I'm a pediatrician who works in one of the greatest clinics in the world, the Ness Abraham Children's Clinic. We serve mostly Black and brown kids and families, and we provide care across the spectrum, from primary care for mental health, dental, and medical care. I love my job, and I also realize that I am reminded every day that I'm a rarity because I know that the chance of being kicked out of school for someone like me is 1 in 5 in this country. I know that the chance of a Black man being imprisoned is 1 in 3 in this country. I know that the opportunities for people based on the color of their skin make getting to a position like mine one of great privilege, and also I feel important responsibility. We have to talk about this issue from a perspective of a broader community and generational views, because the impacts that we're talking about today are the end result of many, many different layers of racism throughout our society. It is a process. As a pediatrician, I see this as a process of criminalizing children based on the color of their skin. It's a process of criminalization that goes all the way back to data that I just should not need to know or have to talk about, all the way back to preschools where teachers rate some incidents as more troubling and warranting discipline if a child's skin is brown or Black. A process that says that in addition to being 1 chance in 3 likely of being imprisoned in the course of the life of someone like me, that if you're a Black girl, you're almost 4 times more likely to be arrested in school than if you're a white girl. If you're a Latina student, you're 2.7 times more likely to be arrested in elementary school than a white girl. You have to notice that those are statistics that should not even occur. The idea of being arrested in school, let alone the disparity in that number. What I know is that when I see kids in our clinic, 1 in 3 to 1 in 4 of them have a parent who has spent time in prison. There's this process of criminalization that turns our society's eyes, unfortunately, from seeing beautiful, cute, and lovable children to seeing threats as they go through their lives. And I know every mother and grandmother has to talk to their children about this transition that will occur in their life. Every mother, grandparent, and father has to have the talk with their child about how the world will begin to see them as they grow older. I know that this starts to culminate in the kinds of things that have already been talked about like what I consider sort of this earthquake effect, that when incidents are happening around children, it has a direct effect on children. What we heard about in terms of the mental health effects across the state for Black adults, when a shooting of an unarmed Black person happens is known. And what is also known are the effects on school performance and behavior for Black and brown children in neighborhoods where these shootings occur as well. It's an earthquake effect that emanates throughout societies and across communities. I know that someone like me has a 1 in 1,000 chance of dying by a police gunfire in this country. These are the things that are creating the opportunities for this end effect of criminalization and therefore shootings to occur. And we have to understand this across communities and across generations. Anyone who spent any time listening on Juneteenth, on Friday, to the anguish and the grief and the ongoing pain that families feel when a loved one in their family has been shot by police knows that this is generational. It goes on and on. It affects peripheral parts of families and communities for generations to come. And we also know that there are solutions that work to reduce officer shooting of Black and brown people. They know that there are systematic solutions that have significant effects on the performance. Things like requiring officers to use all other means before shooting, requiring all use of force to be reported, banning chokeholds and strangleholds, having a use of force continuum that is strictly enforced, and using very good de-escalation techniques. Those are all important measures. We have to look at this as a systemic and systematic problem that criminalizes, from society's view, young Black and brown people, and then places them in harm's way at the end of a barrel of a gun in the early parts of their young and promising lives. These are such horrific situations that we live in. We can't wait. We can't wait for longer and longer drawn out conversations. We can't wait for debates about whether or not the minutiae of the details are being appropriately considered in every way. This is such a pandemic crisis, and it has been around for so many, hundreds of years. We cannot be the generation that perpetuates this. We have to look out for our next generation and the people we care about. I am so passionate about this, but not because of any particular self-interest necessarily, but just because we are human beings and we need to treat each other better. Thank you.
Dr. Analisa Abraham.
Thank you so much for having me. My name is Dr. Ness Abraham, and I am a pediatrician at the Harborview Pediatrics Clinic, which I might say Dr. Danielson is a phenomenal clinic as well. I also, my patient population is essentially Black and brown children as well. I think in the content of this, one of the most heartbreaking things is what we as a community have to deal with. We just heard Dr. Danielson speak on the numbers. But those numbers also translate to real life experiences and real life issues that our people have to deal with. In the past couple of months, I have answered questions from my daughters that have been the most heartbreaking, including, is it safe for us to have an alarm system in our house? Because at 6'4", they know that their father is a Black man and can be seen, his very presence can be threatening. without doing anything. His very figure and his very presence can be threatening. And it's a heartbreaking thing to have to answer to my children. The other thing is, as Dr. Danielson pointed out, we know that children, Black children, are seen as a threat at a much younger age. And many families, both in my clinic and in the community, have said, at what point does my child go from being seen as a cute cub to a full-fledged lion that's worthy of being feared? Unfortunately, young girls, young Black girls, are seen as losing their innocence as young as age 5. And we have seen that young Black men can also be seen as the same. What I want to talk about specifically is the effects of structural racism, police brutality, and police violence, or even witnessing these things, the type of issues that this can create in the family, which is what we take care of as pediatricians. The framework for this is that policing essentially happens, police exposure happens with children in their communities where they should be feeling the most safe. And repetitive traumatic police experiences in children in their neighborhoods, which we know are over-policed in general, leads to traumatizing outcomes, which then leads to negative health outcomes. This is both mental health outcomes and physical health outcomes. These types of events are making our communities more sick. They are killing our communities. Black neighborhoods are over-policed, and who is seen as suspicious and threatening is at the discretion of individual officers. Now, we know that due to racial bias and racism, that policing happens to Black people at a much higher incidence. A lot of this, a few things I do want to see is, what are the types of exposures that lead to negative health outcomes? And right now, I do want to honor the work of Dr. Rhea Boyd. This has been her life work, and she wrote an incredible paper that really looked at where are the exposures that children interact with police or police violence or police brutality, and what are the outcomes that we see in these communities. Now, Dr. Danielson had already said that 1 in 3 Black men have a risk of being jailed in their life. That disproportionate disruption of family and family members, and that disproportionate witnessing of Black children and Black families, seeing what's happening to their communities. And also, they're also seeing the criminalization of both their family members, but also their peers at much higher rates, leads to negative health outcomes. Now, there's 3 different types. First is the frequent encounters, just physically seeing your neighborhood being policed. That essentially sends a message to children saying that we believe that there are criminals here, just point blank. And having the police presence in those neighborhoods leads to negative mental health outcomes. It leads to consistent stress that we have known. That kind of toxic stress leads to epigenetic changes, and that is a generational issue. That does not just affect the generation that is dealing with it. It affects many generations down the line. Is exposure to violence, just merely witnessing a violent act happening to another person, not even to you, not even to a family member. Witnessing that violence leads to many negative health outcomes: PTSD, depression, poor school performance, police expulsion from school. They're essentially cascading down and affecting other social determinants of health and essentially doing a disservice to our children. And then the last is exposure to caregiver encounters. So knowing that your caregiver might have an encounter with police, and what happens with over-policing and the traumatic witnessing of repetitive negative encounters with the police. We know that Black men are incarcerated at a much higher age, at a much higher rate. They are injured at a much higher rate. They are killed at a much higher rate. And we are destroying families by doing this. We are leaving families without a caregiver, which leads to a socioeconomic impact. Parental incarceration in and of itself is associated with a very strong negative, very strong mental health issues, but also things such as asthma and migraines in children. So police brutality essentially disrupts families, and it disrupts generations of families that should be given the opportunity to be healthy. So as Dr. Williams said, we did send a letter to the committee essentially saying that in addition to declaring police brutality and racism as public health crises, we need to understand that racism is actually a root cause of many of the things that we are seeing here. It is not a time to mince words, like Dr. Danielson said. It is a time for us to get uncomfortable, because many of our communities have been uncomfortable for years. We live in fear for years, and that persistent living in fear for children is unhealthy, and it is actually leading to negative health outcomes and death. Okay. In addition to essentially saying that we need these things declared as crises, we actually have specific demands in the letter, including exploring community-based alternatives to public safety and funding programs that we know address other social determinants of health, and using budgets that we are using for police right now instead to funnel into the communities to address many of these issues, including employment initiatives, education, and housing. So essentially, I think the ask here is very, very clear. It's allowing communities, specifically Black children and communities, to thrive by preventing the possibility of negative police interactions, police violence, and even more, the persistent fear of having an encounter that might lead to the death of a loved one or the death or a personal injury. Thank you.
Thank you so much. I will add some words before we finish up with Edwin Lindo. So I do want to add that when we talk about all of these issues and what the proposals that we have presented before in our demand letter that has been signed now by more than 4,000 healthcare workers throughout the state, is that our ultimate goal is to provide very concrete ways in which we can reallocate funding that is currently being used to over-police communities of color into programs and systems that have been proven by data time and time again to have more of an impact on our communities and help improve the health and well-being of all of our communities. I want to add on 3 different points to address this. The first being, we do support the abolition of police. I support the abolition of police. The reason being is that for some of you, you already live in an abolitionist state. There are no police that are coming in your communities on a routine basis, monitoring the streets. And it is based on the perception that crime does not happen there, which I will get to in my second point. But there are communities in the United States that already live in a police-free state. They're neighbors, they're your kids' friends' parents. And thus they are seen as someone who is not a threat. But the conversations that doesn't happen is what happens when those individuals go to work, and what kind of work are they doing when they go out into the communities where they actually exert their influence, which is often the communities of color, not in the communities that are more affluent and more white. The second being, well, they have to be in those communities of color because that's where all the crime happens. Thus, they're going to be there. We all know that police don't prevent crime. They are there to help try and control a population that they feel like are the criminals. What we know is that the population of the United States is 323 million people. The population of Blacks in the United States is 41 million, approximately 13%. The population of whites in the US is 235 million, approximately 73%. The number of murders in 2016 were 9,374. Murders by Blacks, 4,394 out of those, 52%. So people have now used that data oftentimes in the social media platform saying that, well, Black Americans create 50% of the crime in the United States, the murders in the United States. Well, if you take that murder by the population, 4,935 out of 41 million, that's 0.01%. Murder by whites, 4,192. If you take the murder of whites based on their population, that's 0.001%. Not much of a difference, not even statistically significant. So there is no Blacks commit more crimes or Blacks are more criminal, and thus they must be policed more. It is a perception, and it is a way in which we, within this community and within the United States, have been made since childhood to be seen as a threat and criminals that must be policed. And that doesn't need to happen within other communities, which is absolutely false. I want to take it to the next point, which is when we talk about enacting these policies, it is not to make our communities and the world more dangerous. The idea of reinvesting our funds into programs that have been deemed to already and proven to already work and help improve the health of the community around them, think of it like this. When we created the curb cutouts for those with disabilities to be able to have better access to the sidewalks, it wasn't just those with disabilities who benefited from that. Women who are pregnant, pushing a stroller, people who are pushing shopping carts who need to get somewhere with their groceries. Everybody started using those cutouts. So it's not like when we ask for these funds to be reaccumulated and reallocated into communities, it's only the Black people that will benefit. We know that all of those in our community will benefit from this, not just one group. And so we want to make for sure that we are advocating for the health of our entire community. And that starts by centering those who are most marginalized. Edwin Lindo.
Thank you, Dr. Williams. Again, to the council, thank you to the chair. We truly appreciate having just what we hope is the beginning conversation and it is in an incredibly important topic. Similarly to Dr. Williams and to what everyone else has been saying, we take this incredibly close to the heart because it is directly affecting our communities, not in our work alone, but in the communities of the children we're raising, our grandparents and our uncles and our cousins. I'm a critical race theory scholar at the University of Washington School of Medicine, where I teach racism, race, and the understanding of power and white supremacy to our future doctors, to understand that racism has a direct impact on the health of the communities that have been historically and contemporarily marginalized and oppressed. So what does that mean? Why is the non-doctor speaking right now? Well, the truth is to provide some context. Being one of the co-organizers with Dr. Williams of the march that had over 10,000 people that showed up about 2 weeks ago, we had very simple demands. The first is, and what we ask, that this be the low-hanging fruit that this council can move forward on, that to declare racism and police violence as a public health emergency. That's what it is and how it must be declared. We know that King County Public Health has declared that, but they did not declare police violence as a public health crisis. We think as a county, as a board of elected officials, that statement should be made very clear. Another is to eliminate the legislative provisions that shield law enforcement officers from investigation and accountability. You all were just talking about this. It boggles my mind how we are determining policy for investigation based on statewide associations that have the self-interest of protecting those same individuals they're providing policies for, meaning the Washington State Sheriff's Association is creating the policy of self-reporting and self-investigation. That doesn't make any sense. Every one of the doctors that is here in this meeting, if they did something in their clinic that harmed the patient, they wouldn't get to investigate what that harm was and what it looked like. They also didn't get 48 hours to determine how they were going to share the story that took place when that patient had a poor outcome. And again, so those are different standards, yet for incredibly important jobs that are taking place in our community. Additionally, we talk about funding, as Dr. Williams said, funding programs that are directly actually providing support and help for communities to prevent crime from happening. Having done this research for quite some time, I am almost certain that if we provided housing, food, and education, crime in this country would go down 75%. The other 25% would be because folks have mental health issues that we should also be investing in. But here in Seattle and in almost every law enforcement entity around the country, law enforcement is the #1 mental health referral system in our country. And that's a sad reality that someone carrying a loaded weapon is the #1 referral system that we have in these United States. We should actually have experts that have been trained to engage with and to embrace communities who need help during these crises, but we're not doing that. We also want to demilitarize our law enforcement. And we, again, heard the conversation that those are moves being made, and I think we can move them, as Dr. Danielson said, much quicker, and we can do it faster, and we hope that we do. But the part I really want to hammer on and why this is excruciatingly important is that not only is Dr. Danielson likely to be 1 in 1,000 chance to die at the hands of law enforcement, the data tells us that young Black men being shot by police is a leading cause of death up to the age of 36. A leading cause of death for young Black men is to be shot by law enforcement. That makes me sit in this chair with the Afro-Latina daughter and think, if law enforcement did something to her and we were to sue the county for the misconduct of these law enforcement officers, and let's say we end up in a settlement, and actually King County has actually settled a number of law enforcement misconduct cases, that money is getting paid out of the general funds. My money is paying for law enforcement to terrorize my community. That can't happen anymore. I won't allow my money to do that. Actually, I want a refund because I won't pay someone to continue to terrorize me. The biggest point I also want to make is one on the grounds of human rights, being legally trained. I've done a lot of research around the UN, the Geneva Convention, and the human rights that we all hold in this meeting. And one of those human rights is to be protected against racial persecution. Racial persecution is grounds for both refugee status and grounds for genocide. And it doesn't have to reach the caliber of what occurred in the Holocaust, which is where the definition of genocide came from. It just has to be a killing of a racial community in whole and or in part. The definition would allow, if we were to take asylum, if my good friend Hayden Hamilton went to Canada and knocked on the door and said, I don't feel safe in the United States, he would have grounds to receive asylum from the United States into Canada. That means right now in 2020, we are creating racial refugees. And yet our country is looking across the globe to find ways to support refugees, yet we're not supporting the communities and the refugees that we're creating in our own backyard. And I'm not suggesting that Black folks need to leave the United States or they should seek asylum. What I'm suggesting is that it is so awful that the UN would declare human rights violations right now. And so we ask that we not just take this as a point on the agenda, but that we actually take up the flag of justice, that we stick it 10 feet into the ground so that it is immovable, and that we don't stop this work until we achieve it. And the last that I would ask is that we make sure that we end the violence against protesters that are fighting under the First Amendment right for the justice of communities, even when that community isn't their own. We're talking about white folks, Asian folks, Black folks fighting for justice as protesters, and they're getting treated as though they are terrorists. And I can't stand for that anymore. And I will give my time, but it is an honor to join you all and to join this panel. Thank you.
Thank you so much, Edwin, and to all the doctors who joined us today. Your testimony was very powerful. Are you able to send us a written list of those demands that you just made so we can distribute it to our entire committee and council?
Absolutely.
Thank you so much, Edwin. I appreciate that. Madam Clerk, do we have anyone on for public testimony today?
Yes, we do, Mr. Chair.
Okay, so in our last 20 minutes, well, that's how we'll be using our time. Thank you so much. Thank you very much to our panelists and to presenters today. Now that we have finished our briefings, I would like to move into public comment. Having an entirely remote meeting is unusual for the King County Council, and I want to be sure that everyone who has called in understands the rules for public comment and how the process will be managed. First, some ground rules. Public comment must be related to items on today's meeting agenda and not be used for the purposes of assisting a campaign for election of any person to office or the promotion or opposition to any ballot proposition. It must also not include obscene speech. If a speaker fails to abide by these restrictions, I will rule the speaker out of order and require the speaker to exit the virtual meeting. Now I will describe the process. As all the members of the public joined the meeting today, they were automatically muted. I can see your name or last 3 digits of your phone number. Our committee clerk will call the names and numbers. When your name or last 3 digits of your phone number is called, staff will unmute your line. Please make sure to also unmute your line if you have muted yourself as a courtesy. Before you begin your testimony, please wait to be acknowledged to be sure we can hear you, and then start by saying and spelling your name so we can capture it accurately for the record. If you wish for your video to be turned on for public comment, please request this before beginning. You will have 2 minutes to speak, and we will hear a timer go off when you have reached 2 minutes. You can finish your thought, but also wrap up your comments to allow the next person to speak. If you go past 2 minutes, you may get muted. If you're listening on the TV or streaming, please turn that function off. Otherwise, we will hear feedback. If you are disruptive to the meeting, I will ask staff to hang up the call so you have to leave the meeting. Please hang up after you have provided your comment to make it easier for us to manage the call. You can follow the remainder of the meeting on King County TV, Channel 22, or stream online. The link to stream online is on the council's website, kingcounty.gov/council, and click on the Watch Us Live button. We will now begin the public comment period. A reminder to please wait to be acknowledged to be sure we can hear you. Madam Clerk, please go ahead and begin calling names, numbers for public comment.
Thank you, Mr. Chair. The first person is Elaine Simon. Please go ahead.
Hi, my name is Elaine Simon, ELAINE SIMONS, and I live in Renton, Washington. On May 31st, 2019, my foster son, Jesse Saray, was murdered by Officer Jeff Nelson in Auburn Police Department. He was number 3 of victims by this officer in less than 11 years. My question and my concern and statement is we need to unblock the lawsuit put out by Auburn, Kent, Federal Way, and Renton to allow the process of the inquest to go through. We have been fighting as a family since 2019, trying to have this case looked at, and it has been buried deeply. There are so many Black and brown and Native bodies being killed by police, not just in Washington, but statewide and nationally. And for families to sit here and be triggered over and over every time we see on the news of another police killing and no support to our families, it has been causing us a lot of, it's just re-traumatizing us over and over. And so I'm asking you, please unblock the inquest and allow us to be able to have answers for our families and bring peace to us. Jesse was in a mental health crisis, and under the I-940, no mental health backup was provided. Nobody came to de-escalate the situation. Only the officer came, and after he shot my son the first time in the stomach, and he was down, Officer Jeff Nelson did the execution shot into his head and killed him. And we believe that there was no reason for that double shot. He was already down and defenseless. I'm new at this activism. This is brand new, going out and sharing my story about my foster son. So I just, again, please listen to people, listen to the families, listen and allow us the opportunity for people to really look at our cases and see where some mistakes have happened. And if I can say anything, Officer Nelson needs to be removed and placed out, not have a gun in his hand while the investigation's going on. I'm afraid a 4th child is going to be killed. I don't know if I'm at 2 minutes, but
Yes.
I belong to a group called Families the Front Line, and we're a national group of parents and family members who are trying to come up with police reforms. Thank you so much for your time, and I really hope that you take a look at Jesse Saray's case.
Thank you so much.
The next person is Ben Israel. Go ahead, please. You are muted on our end.
Yes, my name is spelled Benyisrael. Policing in the United States is inherently racist for the following reasons. The original police in the United States were slave catchers. After the Emancipation Proclamation, the 13th Amendment made it legal to enslave people that had committed a crime. Vagrancy laws were passed that made it a crime to be homeless or unemployed. The police were used to arrest former slaves, and the state leased them out to plantation owners in the convict lease system that lasted until 1928. Police also enforced racial segregation laws known as Jim Crow until 1965. In the 1960s, police and law enforcement agencies crushed the civil rights movement. The FBI created the Counterintelligence Program, or COINTELPRO. The stated purpose was to discredit, disrupt, and destroy all Black nationalist movements. In the 70s, Nixon declared a war on crime. In the 1980s, Reagan declared war on drugs. While statistics have shown that more whites use illegal drugs by percentage, a disproportionate amount of Black and brown people were arrested by police and put in prison. In the 90s, Joe Biden authored and Bill Clinton signed the crime bill that encouraged the growth of mass incarceration. Racist policing is a health crisis because it destroys society's most valuable resource, the family. It is difficult for families that are incarcerated to survive because one less person is contributing. And legal fees also provide a difficult challenge. It's difficult for the formerly incarcerated to get employment once they are released. Racist policing perpetuates poverty and social stigma, making it difficult to have access to quality housing, quality food, and quality health care. Poverty also impacts mental health and stress. Policing is a racist practice that helps keep so-called Black people sick, poor, and broke. It keeps modern-day plantations, aka prisons, full, so private companies and the state can make a profit off of free and near-free labor. Policing past and present shows the sickness and psychopathy of the American society.
Time.
Thank you so much.
Thank you. The next person is Abil, and I think it might be Abil will do. Go ahead, please. You are unmuted.
Hello, my name is Abia Woldu, and I am the current chair of CACWIO, which is the Citizens Oversight Group for the OLEO office. I'm here today for two reasons. One, to say as the Community Oversight Group, we are here to voice our support for OLEO and its recommendations for the Sheriff's Office. And secondly, as a Black man from the south side of Seattle, I think this is an important conversation to have, and that it should be known that this is a public health crisis. I think a public health crisis is anything that causes an undue burden to a community of people and causes them to change their actions for that reason, whether it be COVID and causing us to stay inside, or for me, making sure that everything I do in the presence of the people that are supposed to protect and serve me give me undue stress, undue burden, and in all honesty, pain and suffering when I realize that the money that I pay in my taxes has to go and pay off people that have harmed my community, my classmates, my friends. I don't know if you guys know how that feels, but that gut-wrenching feeling to see that you have to write recommendations because you see your friend is no longer here, and you have to sit in a meeting and listen to somebody explain why and how that came to be, and you'll never be able to hear your friend's side of the story is something that no person should live through. I do want to say that the recommendations offered today will help in that process. And outside of that, today, CACWIO has sent in a letter to the county council in response to body cameras, and I hope you guys take some time to read through those recommendations. I think not only will they protect the community, but they'll protect things outside.
Time.
Thank you guys for the time.
Thank you.
Thank you. The next person on the line is Alicia Bush. Go ahead, please. You're unmuted.
Thank you. Hi, my name is Alicia Bush, and I am an anti-racist activist in South King County. And we have been working really hard over the last several months to meet with our local communities. I live in Maple Valley, and with cities in South King County to put together a proclamation to meaningfully address systemic racism, how it manifests in our communities, and how it harms our communities of color. We had a really powerful conversation last Thursday with Covington, Maple Valley, Black Diamond, and Enumclaw, and they were very engaged. It was a very encouraging bipartisan conversation. And this proclamation isn't just saying words, it's also with demands for accountability and ongoing work. And part of that accountability, I feel like, rests very heavily within our city government and law enforcement. I do not understand why the cities of Auburn, Renton, Federal Way, and Kent are in opposition to transparency. This protects everybody. And, when we look at situations like 12 days ago, another unarmed Black man was murdered for doing things that I have literally done myself. When I was in my 20s, I got drunk and fell asleep in my car and was woken by police and panicked and started to run. They grabbed my arm, called my parents, and I went home. Rayshard Brooks was murdered for doing the same thing that I did in my 20s. Why are there different outcomes? We have to address these situations, and we have to do it meaningfully, and there has to be accountability on all levels. Thank you.
Thank you. The next person on the line is Analisa Thomas. Go ahead, please. You are unmuted.
Hello, my name is Analisa Thomas. Annalesa. Thomas is Thomas. And I am co-founder of Next Steps Washington. I lost my son in 2013 in a police shooting. I would like to say that I fully support all the recommendations made by Deborah Jacobs and her office. They are plain and simple common sense. And that is the avenue we need to travel down, is common sense. Most particularly, I would like to speak to de-escalation. De-escalation needs to happen way before officers get to an incident. They have the opportunity to engage in target practice. They need to have the opportunity to engage in de-escalation tactics. And further, I feel like the lessons learned should be implemented. And the lessons I have learned in the last 7 years are: an unarmed man, regardless of how long the time has been, should never be shot. There is another avenue, and police need to find and learn those avenues so that we lose less people to officer-involved shootings. And the last comment I'd like to make is about the witness statements for police. In our incident, I watched my son get shot. I was interviewed immediately and for 4 hours afterwards. If you are going to apply a 48-hour waiting period for the officer involved, you should do that to the witnesses that have been involved as well. So I think it should be an even playing field for all. Thank you for your time. I appreciate it.
Thank you. The next person is Asha Mohammed. Please unmute yourself and go ahead.
Thank you so much for this robust and vulnerable conversation. I'm sorry for everybody that lost their loved ones. Good energy, thoughts, and prayers are with you, from my family to yours. And thank you for sharing the terror that you guys go through.
Asha, we're losing you. Maybe try turning off your video and starting over if that works for you.
This is personal. Any color or a Black person, it's extremely. Is this better? Is this better?
Yeah, this is much better. May we restart Asha's time and let her go ahead again?
Thank you. My name is Asha Mohammed. I'm the executive director of Somali Youth and Family Club, which is a nonprofit. I'm a resident of White Center for 26 years. My condolences to every family that have shared that they lost their loved ones. And furthermore, for my 2 minutes, as someone that came into this country 26 years ago, we would like to have transparency in co-designing the responses and to be included in the conversation as humanly as possible. My position in understanding systemic oppression or systemic racism or racist structure is 3 steps, which one is reform, another one is to defund, and another one is to disband. We are having very volatile responses. However, for someone that has worked with victim of sexual assault, someone that has worked with children abductions, someone that has worked with vulnerable population where police was their first resort to call, there are many things that we need to look at it and honestly have a robust conversation of the failure of the public health system that we have, the lack of investment that the Reagan time has happened in this country that is not addressed. The lack of investment in services, the lack of government doing its job and passing the buck to nonprofit. So I think I would like to have a better understanding, a better communication, a better transparency for what the process looks like. I am absolutely. Thank you.
Thank you so much, Asha.
Thank you. The next person to speak is Karen Chase. Please go ahead and unmute yourself. I've got Karen Chase. I think she left. The next person is Chris Franco. Please go ahead. You are muted. Chris Franco, would you like to speak? If so, please unmute yourself. I will move on. The next person is Hayden Hamilton. Please go ahead and unmute yourself if you'd like to speak. Hayden Hamilton. Okay, we've got Joseph Lockman. Please unmute yourself and go ahead.
Hello, council members. Thank you for the opportunity to give public comment. The points that I'd like to outline today are in support of the OLEO recommendations, and were also included in the February letter that a group of community-based organizations provided to council previously. And just to quickly outline the points, I'd like to emphasize that the King County Sheriff's Office should absolutely create more robust standards for use of force, such as the idea of only when there's an imminent risk of harm. Also discussing the implementing rules to prevent escalation. So rather than the framing of, we like the framing of de-escalation, but really talking about preventing escalation of incidents, including in reference to the killing of my Chance Dunlop Gittens, thinking about the situation where detectives were, as according to the investigation, the idea that they unnecessarily may have put themselves in harm's way. Again, aligning with Deborah Jacobs' comments and looking at the circumstances that led to a situation where they felt that there was an imminent risk, and essentially ensuring that we're not having officers escalating situations unnecessarily. Strengthening policies that are improving accuracy and utility of deputy interviews, and the idea of shifting to end of shift as opposed to the 48 hours, and again ensuring that there's not a double standard in terms of how civilians versus officers are being given a certain amount of time to prepare their statement for an interview, and also enabling the critical investigation review board to conduct a full, thorough review, making sure that it's comprehensive, including the events that are leading up to a shooting, and discussing whether or not they really did use proper de-escalation tactics. And again, speaking also in support of Elaine Simon and the other families that have been affected by police violence, and noting that this was done, these are community-based, community-driven changes that organizations have worked on together to support, both with the inquest process, but also with supporting the recommendations that the Office of Law Enforcement Oversight has discussed today. Thank you.
Thank you. The next person on the line is Julia Dorman. Please unmute yourself and go ahead and speak. Julia Dorman, would you like to speak? Okay, the next person is Christiana. You are unmuted. Go ahead.
Hey, thank you so much. And thank you also for holding this important discussion. I know it's been long overdue for a number of years. My name is Christiana De Lyon, Kristiana. De Lyon is lowercase d-e space capital L and then E-O-N. I will also mention that I am a council member for the city of Black Diamond. While I'm not here to say that I'm here representing the council or actually any of the participants that were in the four-city meeting that was alluded to earlier by organizer Alicia Bush, I can say that it was an incredibly powerful conversation and a very critical first step for how to engage more suburban and more rural communities in this conversation. And I'm going to ask that as we move forward with it, because it does appear there was a lot of strong interest and a lot of, especially from a lot of different perspectives and people coming with a lot of different backgrounds, I'd say, that we really look at how we include these more rural and more suburban communities in this conversation, particularly because, for example, my city is not so diverse yet, but we are growing and changing. And it's going to be very critical that we work and move proactively as we move forward into the next chapter of our city, that all of these conversations really also integrate the needs of these smaller communities. So I'm just asking that we become part of that conversation and maintain also that these more southern or more eastern parts of the county are represented and brought into this conversation as well. Thank you though so much for everybody who has been participating. It's really powerful. I'm looking forward to doing at least whatever I can in my capacity to move that work forward.
Thank you. The next person is legal team. Please give us your name, and if you could spell it, that'd be great.
Sure. My name is Corey, C-O-R-E-Y, last name Gilmette, G-U-I-L-M-E-T-T-E. And I'm an attorney at the Public Defender Association who works on police accountability. And I'm testifying today to share recommendations made in a February letter from 15 community groups to the King County Sheriff's Office regarding its use of force policies. KCSO's use of force policies must be improved in 4 critical areas. First, KCSO must create a more robust standard for the use of deadly force. As Olio has recommended, the use of deadly force should only be authorized when there is an imminent risk of serious physical harm to the law enforcement member or others. Second, KCSO must implement policies that seek to prevent escalation. Just as de-escalation is a critical technique in avoiding the unnecessary use of force, preventing escalation must be as well. Third, as Olio recommends, deputies involved in a critical force incident must provide an oral interview prior to the end of the member's shift. There is no reason for treating police officers any differently than any other person in a homicide investigation. Fourth, as Olio has recommended, the Critical Incident Review Board must provide a comprehensive review of all officer-involved shootings and serious force incidents. And I want to end by saying that this is a technical topic, and it's easy to view topics like this dispassionately as a result. However, these recommendations come at the very same time that KCSO is suing to block King County's inquest process, and we've heard about the consequences of that from other families today. But what we're talking about here is life and death. We're talking about fathers, mothers, sons, cousins killed by police officers. And I ask that these changes be made with the urgency that reflects the value of the lives that have been lost and unfortunately will continue to be lost. Thank you.
Thank you. The next person is Marla Murdoch. Please unmute yourself and go ahead.
Can you hear me?
Yes, we can.
Okay. My name's Marla Murdoch, M-A-R-L-A, Murdoch, M-U-R-D-O-C-K. Thank you. I'm a concerned constituent of District 1. I'm a white affluent person, and my heart is broken from the stories that I hear and continue to hear from families who have lost members, sons, daughters, fathers from police violence. This has to change. If we look at investigations that are done, many of these families have received monetary settlements. There's a big disconnect and something's wrong that if you can admit and pay and give money, which in a sense is saying that that was a wrongful death. These police officers and sheriffs stay on their jobs. If they are by some chance fired, they go to another department, have nothing follow them, and continue the same pattern. I'm also here primarily too in support of Olio's report and the 43 recommendations they outlined, and also in support for the demands and fact that police violence and racism is truly a public health crisis. This cannot be understated. This is crucial to be addressed now and not just be put on the table as it has year after year. Policy changes are just a first step. Also, training of law enforcement that emphasizes shoot to kill instead of de-escalation must be changed. And most importantly, we need to address the systemic racism that exists in the law enforcement system, which results in disproportionate killing and devaluing of Black and brown bodies. And Olio's Olio's recommendations and also the demands that we have heard from doctors and the professor at the University of Washington, they must be addressed.
Thank you. The next person is Melissa Taylor. Go ahead, please. You are muted.
Hello, Melissa Taylor, MELISSA, space TAYLOR. I would like to thank the chair and all of the guest speakers today for your advocacy to make our community better. I appreciate the opportunity to listen to the conversation. I'm here today as a member of King County Democratic Central Committee's Executive Board. For context, this body consists of 60 members, including representatives from each of the 17 legislative districts in King County, as well as 9 officers, all elected by the over 1,000 elected precinct committee officers in King County. Last night, we voted unanimously in support of a resolution that included a series of provisions directed at the King County Council, Executive, and Sheriff's Office, which will be sent separately. But in the context of today's Olio report, I would like to share the following 2 resolved clauses. Be it further resolved that the King County Democrats call on the King County Council and King County Sheriff's Office in cooperation with Olio to improve internal investigative and review mechanisms regarding officer-involved shootings, including responding to each of the recommendations in the February 2020 Olio report. Be it further resolved that the King County Democrats call on the King County Sheriff's Office to cease fighting against the reformed inquest process of King County, to require officers show up to testify when summoned as a part of inquest when an officer-involved killing occurs, to stop all efforts to prevent inquest juries from making a finding of criminality as part of the inquest process. From a personal perspective, as a white woman, I want primarily to affirm, support, and stand in solidarity with the views and policies shared by today's guests. That being said, in response to Councilmember Lambert's comments earlier, I want to state very clearly that the current state of law enforcement in our county also makes me feel less safe. And deflecting in this moment to talk about how people you talk to love their police officers concerns me about the level of seriousness and urgency you bring to ensuring the safety of everyone in our county. For all of the county council members, every use of force by our law enforcement should be viewed as an error that needs to be corrected. We should not be using force against our civilians. Thank you.
Thank you. The next person is listed as Nick's iPhone. Go ahead and unmute yourself. And if you could give us your full name, that'd be great. Nick.
At the end, I'd like to make a comment.
Councilmember Lambert, did you say something? I couldn't hear.
At the end of public testimony, I'd like to make a comment.
Okay.
Nick's iPhone, one more chance. Okay. The next person is Rachel Scott. Go ahead, please. Rachel Scott, if you want to mute yourself, you can speak. We'll move on. The next person is Sean Goody. If you'd like to speak, please unmute yourself. Go ahead.
Thank you. It's Sean Good, SeanGoode. As we speak to pandemics, the current COVID infection rate for Washington State positive tests is 6%. And as a result, yesterday, Governor Inslee declared on Friday that he's going to mandate the wearing of masks in indoor public and outdoor spaces, which seems like a just response to a pandemic that seemingly is not going away. Well, the population of African Americans in King County is also approximately 6%. And we also have an equally as dangerous pandemic present in the disease of racism. The city of Seattle has used about $233 million to respond to COVID. That type of investment is the same investment that's necessary to combat the vicious disease of racism in our community. I urge the county council to act with expediency in divesting from areas that perpetuate the spread of the disease of racism. Particularly as it speaks to the work in law enforcement, that if law enforcement is leading to the deaths of Black people or the incarceration and ultimately the destruction of community for Black community, then we should consider immediately ways that we can divest from law enforcement and begin to invest in community-based alternatives. To say that the experience of some is different than the experience of others, and as a result, this type of expedient response is unnecessary, is just like the people who are advocating for not wearing a mask right now because they've been in plenty of conversation with people without masks on and have yet to contract COVID. It is imperative in this moment that we respond with urgency, that we divest from these institutions that perpetuate systemic racism and begin to invest in the cure and do it with the same zeal and energy that we have for COVID-19. Thank you so much for creating a space for me to share. Remember, 6% Washington State, that's the positive test rate. 6% of residents of King County are African American. The numbers are the same. The impact on death is probable. Let's respond accordingly.
Thank you. The next person on the line has the last 3 digits of their phone number as 344. Go ahead, please. The area code is 206. Last 3 digits is 344. You are unmuted. If you'd like to speak, please go ahead.
Madam Clerk, moving forward, may we only ask people once?
Okay. Yes, Mr. Chair. I believe I've called everyone on the line.
Thank you so much for those powerful testimonies. Councilmember Lambert, did you want to say something?
Thank you, Mr. Chair. I certainly do. Apparently what I said was completely misunderstood. I did not say moving forward was unnecessary. As a matter of fact, I'm a sponsor of the FERS program and many other programs. I also have children of color, so I have personal experiences. But my point was that we all need to work together, and it's going to take everybody working together. And I think blanketly saying that any group is all wrong is not going to help us get to the bridges that we need to do to make the changes that we are all agreeing need to be made. So I think that we need to focus on making sure that we're all working together. Thank you, Mr. Chair.
Thank you, Councilmember Lambert. I just want to thank everybody who joined today's call. Thank you especially to the families who've lost loved ones, who continue to join us and re-traumatize yourself, speaking about things that no family should ever have to face. And you do so with the hopes that you're creating a better world. And I assure you that we are continuing to work on the things that you have spoken about your efforts are not in vain. And when we talk about creating a better world, the energy and the momentum that we're feeling right now is not people saying they want to tweak and create incremental change. People are saying our system is fundamentally broken and we need a new system of public safety that's rooted in community-based alternatives and economic justice. Those are the things people are saying. You know, when doctors and medical professionals come on and they tell us that police are the #1 responders to mental health crises, that is a fundamentally broken system. We need to make sure that we're able to reduce the duties of our police departments and reallocate those resources to more effective places. That's what people mean when they say defund. When they say defund, they're not saying promote lawlessness and eliminate accountability. They're saying let's invest in the things that we know work better. So hopefully we can work on those big, bold changes where we're saying that mental health officers respond to mental health crises. Youth violence is met with people who have relationships and trust with the youth through youth development programs. That traffic management is not done by somebody with a loaded weapon. And that system shows us why we've lost so many people at traffic stops. Countless names, Black individuals being killed at traffic stops for a system that has no business having an armed weapon or a loaded weapon in that situation. We can have a bike brigade, an unarmed bike brigade. These are all alternatives that we should be pursuing. And I know those kinds of changes require legal changes that our council is currently working on. Our charter has restrictions. Our process of negotiating and bargaining with unions has restrictions. And those are all things that we are focused on. So I assure you that the conversations about big, bold changes that people have been telling us, those are things that we are pushing for and that we will continue to fight for. So thank you so much, everyone, for joining us today. And we will continue working with you. And for those of you who have asked for more transparency and collaboration, please reach out to our office directly so we can make sure that these public meetings are reaching impacted communities and communities that may be not seeing this kind of public collaboration happening. Councilmember Dombrowski, did you want to say something? Please go ahead.
Thank you. I hate to follow the chair's concluding remarks, but I did want to thank you personally for putting together today's meeting and for assembling the panel that you did. To be candid, I had to turn off the video because of the emotional impact it had. It was great to see Dr. Danielson, but also many faces in the medical community that were new to me, and to hear and listen to their voices was particularly compelling. And I want to join you in your pledge to implement the changes that are being sought in a big way and to be bold. And I want to thank the panelists for carrying the burden that they shouldn't have to carry, but did, and continue to do so every day, but also here publicly. And at a minimum, express my allegiance, alliance, and support for getting the work done that we have to do. And I look forward to doing that with you. And thank you and the public who commented today, but especially that panel. I hope KCTV will package that and replay it many times. It is very compelling material that I think we should all hear. Thank you, Mr. Chair.